Look in the mirror right now or don't, because for millions of men, that's exactly the problem. A hairline that's quietly moving backward, a patch at the crown that wasn't there last year, and a strange, specific kind of stress that has nothing to do with vanity and everything to do with control. Hair loss doesn't feel like aging. It feels like watching something happen to you that you can't stop. Here's the good news. We understand hair loss better than almost any other part of aging. We know the exact hormone responsible. We know the exact enzyme that creates it. And we have real, tested, clinically proven treatments. Here's the more complicated news. Every single one of them comes with trade-offs, and the people selling them to you online are not always telling you the full story. So let's actually go through the science properly. Let's start with why hair loss happens at all. Meet DHT, dihydrotestosterone. It's a hormone derived from testosterone created by an enzyme called 5-alpha reductase. DHT is powerful. During puberty, it's part of what builds a deeper voice, facial hair, and a more masculine bone structure. But DHT has a strange, cruel side effect. On the scalp, in genetically sensitive follicles, DHT does the opposite of what it does everywhere else. Instead of growing hair, it shrinks it. This is called miniaturization. Each hair grows back thinner, weaker, shorter, cycle after cycle, until eventually it stops growing back at all. This is male pattern baldness, not stress, not shampoo, not bad genetics in some vague sense. A specific hormone attacking specific follicles that were always going to be vulnerable to it. So if DHT is the problem, there are only two ways to fight it. Block it from being made, or work around the damage it's already doing. That's exactly what these three treatments do. Let's start with the oldest one, Minoxidil. Minoxidil was never designed for hair. It was originally a blood pressure medication. Doctors noticed something strange in trials. Patients were growing hair in unexpected places. That accidental discovery became Rogaine. Minoxidil doesn't touch DHT at all. Instead, it widens blood vessels, increases blood flow to the follicle, and pushes hair into its growth phase sooner. It's approved by the FDA, applied directly to the scalp, and in large-scale trials, it consistently outperforms placebo at regrowing hair and slowing loss. The catch? You have to keep using it. Forever. Stop. And within months, any hair gained is typically lost again. Side effects are usually mild. Scalp irritation, unwanted facial hair if it spreads. In oral form, some cardiovascular effects at higher doses. Compared to what's coming next, Minoxidil is the gentlest option. Now let's talk about Finasteride. This is where things get more serious. Finasteride blocks type 2,5-alpha reductase, the enzyme that converts testosterone into DHT. Less enzyme activity means less DHT, means less attack on the follicle. In clinical trials, Finasteride doesn't just slow hair loss. For many men, it actually reverses miniaturization, regrowing hair that was thinning. It's genuinely one of the most effective tools we have. But here's what you need to know. In 2012, the FDA updated Finasteride's label to include sexual side effects that can persist, even after stopping the drug. In 2022, they added something more serious: suicidal ideation and behavior. As recently as 2025, European regulators formally confirmed that mood-related and sexual side effects may persist after discontinuation in a condition some patients call post-finasteride syndrome. This remains genuinely debated in the medical community. Clinical trials suggest sexual side effects affect a small percentage of users, often reversible, but not always. And regulators on both sides of the Atlantic have decided the risk is real enough to require a warning. This is not a reason to panic. It's a reason to take it seriously. So how common is this actually? Let's look at the real numbers. A large-scale review of clinical trials found sexual side effects in roughly 10.5% of finasteride users. That means For every 10 men who take it, around 9 experience nothing of the kind. A telehealth study tracking over 600,000 patients using compounded topical finasteride and minoxidil found something even more reassuring. Only 2.7% reported any side effect at all. Not just sexual ones, any side effect. Over 80% said they were satisfied with treatment. So yes, the risk is real. It's documented. It's serious enough for regulators to act on. But it is not the majority experience. For most men, these medications are taken for years without incident. The honest picture isn't this drug is dangerous, and it isn't this drug is completely safe. It's this: a small percentage of users experience something serious enough that regulators built a warning around it, and you can't know in advance which group you'll be in. That uncertainty is the actual trade-off, not the statistic itself. Now, Dutasteride, the newest and, in some ways, the most powerful option, where finasteride blocks one type of the enzyme, dutasteride blocks both, type 1 and type 2. The result, dutasteride suppresses DHT more completely than finasteride. In direct comparison studies, dutasteride has outperformed finasteride at regrowing hair. Some trials rank it as the single most effective treatment tested. But there's a catch that matters. Dutasteride stays in your system far longer than finasteride. Its half-life isn't measured in hours. It's measured in weeks. That means if side effects occur, they may take far longer to resolve after stopping. Dutasteride is not officially FDA approved for hair loss in most countries. It's prescribed off-label based on strong evidence from other uses. And it carries a similar, possibly amplified, version of finasteride's risk profile. Stronger effect, longer exposure, more caution required. So here's where that leaves us. Minoxidil, gentle, reversible, requires lifelong use, FDA approved. Finasteride, powerful, FDA approved. Real, documented risk of persistent side effects in a minority of users. Dutasteride, potentially the most effective, longest lasting in your system. Least regulatory oversight. Most caution required. None of these are good or bad, they're trade-offs. And the honest answer to which one should I take isn't something a video can give you. It's something a doctor can. Someone who knows your history, your blood work, your risk tolerance. Here's what's actually happening online right now. Telehealth companies are selling these medications directly, sometimes without the full picture. Compounded topical finasteride, marketed as a safer alternative, was hit with an FDA safety alert in 2025. After dozens of reports of side effects, that mirrored the oral version. The treatments work, the science is real, but the way they're being sold to you is often simpler and safer sounding than the actual evidence supports. So here's the truth about hair loss. It's not a mystery anymore. We know the hormone, we know the enzyme, we have 3 real tools that can genuinely slow it or reverse it. But every single one of them asks you to trade something. Time, risk, certainty. Nothing about aging is free. Not even fighting it. The hair on your head was never really the point. The real question was always whether you understood what you were trading it for.